This is a little more detailed videos. It's a collection of several videos in one, describing basically the issue of hemorrhoids. I know this is the most common condition we treat in rectal disorders, so I will expand a little bit on it. Hemorrhoids are basically unusual lumps that the patient can feel or see in his anus, in the anal area. There could be originating from the skin of the anus around it, and they are called external hemorrhoids, or they could be originating from the anal canal, that's from the inside of the patient, and they protrude to the outside, and therefore they're called internal hemorrhoids. Now, internal hemorrhoids, they have 4 stages. External, they have 1 stage, external. But internal hemorrhoids, they have the first stage where the patient doesn't see anything. He will see only, the symptoms of them, if they bleed or hurt or something, but he doesn't see anything outside. The second stage is where they start to protrude to the outside, which could be felt by the patient after bowel movement or so, but they go back in by themselves. So that's the second stage. The third stage is where they protrude to the outside, they don't go back in by themselves, and the patient will have to either push them back by finger or do some maneuvers, sit on a hard surface or something in order to get them back in, so you will get some relief. The fourth stage is when they become permanently out. This is the last stage and the most advanced stage that we don't like patients to reach before treatment. So this is basically more or less all the stages and types of hemorrhoids. Now, what are the cause of hemorrhoids? Basically heredity. So heredity meaning that the patient inherited the genes that at certain age he will develop certain type of hemorrhoids. So there is nothing you can control about this. I mean, certainly long sitting, constipation, the bad habits of sitting in the bathroom for a long time, and few other little conditions can exacerbate or make them worse, but they don't really cause the formation of hemorrhoids. But okay, once you have them, what happens? Once you have them, they don't disappear, okay? They don't go back, unless you treat them. All the creams and suppositories and a few other things you hear from neighbors and friends will help to alleviate some of the symptoms, but will not actually make them go away. Some kind of intervention is needed. But here is the good news. The good news is that there are so many now equipment and instruments we have, and method by laser mostly, that will allow us to treat them permanently in few minutes, if not few seconds, and without any pain or very little pain. It all depends on what type they are, what stage they're in. So let me take you through this, through a series of videos. I'm showing you the first method, the simplest one, is when you have a stage 1, stage 2, and early stage 3. It's a method called surface laser. This is basically using a low energy laser to treat the hemorrhoid through a little scope. It takes a few seconds, and you can see it on the video. And this is directed to the blood supply of the hemorrhoid. This is where we actually fibrose, close the blood supply to the hemorrhoid, which will cause it to disappear. This is a very effective treatment that we've used it on tens of thousands of patients, and invariably gives good and excellent results. It could be done within minutes, no pain, with going back to work almost immediately. Other cases, you can see a case of a hemorrhoid where the surface laser or this IRC I spoke about is not sufficient to actually cause the healing, and will require a little bit more of an intervention. But it's a simple intervention. This is where we use the Endolaser. This is the laser fiber that we inserted into the hemorrhoid blood supply, and we cause it to scar and shrink and fibrose that way. Meaning no excision, no surgery, no cutting out of anything. It's just the fibrosis that we cause by the laser. in there. And there's essentially no pain, and the patient can go back to work on the same day. This is the laser fiber, you can see it, and this is what we insert into the body, and these are the results after the procedure. You can compare it from before and after. This is another case of also advanced hemorrhoids on both sides. This is the application of the endolaser into the body of the hemorrhoid, and these are the results after. You can compare it by yourself and find how they disappear. This is another case of a large hemorrhoid on the right side, and the patient had also another one on the left side, and this is the endolaser being applied to all his hemorrhoid. There's no cutting, there's no stitching, nothing, and these are the results. Compare it to the previous picture that you saw. This is the one on top is before, and this is after, and you see how it's disappeared. This is another case of very advanced hemorrhoid. This is stage 4, obviously, and this is the endolaser being applied, which, although the case is very advanced and you would think it needs certainly surgery, but you will be surprised how effective the laser is for these cases. In this case, I will show you, this is after the procedure. The right side here totally disappeared. The left side is probably more than 50% disappeared. What you see here, not hemorrhoids anymore. Those is just excess skin. Most of them, they will shrink after a few days to 2 weeks. Some of them will remain, but that's okay. I mean, this is not a cosmetic surgery. We relieve the patient from stage 4 hemorrhoids without all this. This will show you the difference between before and after, and you can tell by yourself the difference. The left side was obviously much larger. That's why you have more residual skin, but this skin will shrink over time. Other cases that could be reviewed this is another case showing you another technique where we actually perform a combination of LHP with what we call THD. THD is actually putting a little small absorbable stitch. You can see it actually right here on the inside. This is actually choking basically the hemorrhoid blood supply. This is necessary in certain cases, and this is what's been done on this patient. This is actually, the patient doesn't feel any pain, doesn't feel it because it's above the skin level, so there is no sensation there, and that will cause this to actually die and shrink and go away. The following are examples of needing to excise, basically remove with laser the body of the hemorrhoid. And this is a case, obviously, you can see it on the top, how it's an extremely large hemorrhoid, very edematous and probably full of blood clots. And these are the results of using our laser method to actually remove it. And you can see immediately the results. They're excellent results with minimally invasive procedure, no stitching to speak of, and excellent healing process. So even in those cases where they need actual removal of the hemorrhoid, excision, surgical removal of the hemorrhoid, once it's used with our method of laser hemorrhoidectomy, the results are excellent. Similar results are actually seen in the second example of multiple large hemorrhoids on both sides, and you can see the results immediately after the procedure. The pain after such a procedure is limited, and most patients are able to go back to work in maybe 1 to 2 days. Overall, whatever the stage of your hemorrhoid, it could be treated with laser. Okay, the laser method differ. We have 7 types of laser methods, so there's not one, and we apply the best method for the hemorrhoid at hand. In one patient, we can use 1 or 2 or even 3 different type of laser methods. The end result is to get rid of your condition with the least amount of pain, and to get you back to your work and your life and family in the shortest amount of time. And remember, all our procedures are done by local anesthesia. That's simple local anesthesia. We give a little bit of sedation, just so you'll be, half asleep for a few minutes, but the procedure itself will be done just like the dentists use dental block, we use anal block to do the anesthesia. And we've done thousands and thousands of these cases. This is our specialty, and that's what we do every day. And I think that is the only way to actually treat these conditions effectively and without pain. Thank you very much.